My name is Ron Chorzewski. I'm a Solutions Consultant with Raider 8. It is a pleasure to welcome everybody to our webinar today. We have a great panel to talk to you about marketing initiatives. And so we're going to run about 35 minutes talking about talking with the panel. We have opened it up for some questions, and then we're going to turn it over to Evan Steele, who is the CEO and founder of Raider 8. And he's going to talk to us a little bit about managing our Gmb profiles. So let's start by introducing the members of our panel. So we have Carrie Jacobs from the True Vision Institute in Minnesota. Hi, welcome, Carrie.
Hi, thank you.
We have Patty Barkey from Bowden Eye Associates in Florida. Thanks for joining us, Patty.
Hello, everyone.
And we have Jill White from the St. Paul Eye Clinic. And
Hi,
I believe that's also in Minnesota, so welcome. Yep. And Jonna Mulaney from Mid-Atlantic Eye Care Service Partners. So welcome, Jonna.
Thank you.
So, this is a great topic, talking about marketing, because there's some really big practices out there. There's small practices, but a lot of the emphasis of marketing initiatives are similar, and there's a lot of overlap. When we talk about marketing, we think about it as, some of us think about it as sales and advertisement. Some of us think about it as relationship building. So I'm sure we're going to touch on both of those points today. As well, we think about who we market to. And we had a meeting to discuss the webinar before we got together. It was really interesting to hear that, we have to market to physicians who refer us patients, and we have to market to our prospective patients as well. So in essence, there's two different marketing campaigns that we can do. So, I'll throw it out to Patty to start. Patty, how do you differentiate your marketing to physicians versus the marketing that you do to prospective patients?
Gosh, so much of it, I like to talk about branding, and you're doing branding. You're branding yourself every opportunity you get, whether it's with the uniforms your staff wear, the logo that goes out on anything in your office, every single piece. So a lot of it's education. I think when we're marketing to our referral sources, whether they're primary care or other eye docs in the community, or, it's interesting. We look at our insurance companies as referral sources too. It's just important to present yourself as an entire package. Our primary care offices need to know, what are we offering our patients? Many primary care offices are behind in our technology. They don't understand the different lens options that are available, the different things we have, for instance, for dry eye. What are the refractive opportunities? So when they have that patient in front of them, they can get them to us. Marketing to our patients is also, it's education. Everything revolves around education. And I think impacting a patient in a way that they remember your name, whether it's by kindness or, new technology, images, whatever it takes to embrace new technology.
Excellent. Excellent. Carrie, I remember when we spoke earlier, you were talking about making sure that your staff was aware of marketing initiatives that you were undertaking. How does that play into your marketing plan?
Really, anything that you do, if your entire staff is not aware of your marketing efforts, you might as well just be throwing your money out the window. No matter what campaign you're launching, no matter what materials you have out there, if you get in a new brochure, if you are doing a new online campaign, make sure your team is aware of everything that you're doing too. If you happen to get on a news segment, for example, you want to make sure that the team is aware of it, and they can also promote it within their own social circles. So the more you communicate with your staff, with your team, the better your marketing is going to actually do. Otherwise, if your phone team has no idea what your marketing efforts are, how are they going to adequately track those incoming leads?
Yeah, excellent. So how do you go about doing that? Is it just an email that you send to the staff, or is there a regular like newsletter that you would send them?
It's a multi-pronged approach. I talk with our counselors, our phone team, on a weekly basis. the entire staff. We touch on what our marketing efforts are at our staff meetings, our monthly staff meetings, but then of course, anything that we're launching out in the public, we also do communicate that internally via email, or we use Microsoft Teams to communicate with our staff internally. And then of course, we have links in our weekly newsletters too.
Excellent, excellent. So Jill, I'm curious, when a new physician joins your practice, I mean, I would think that's an incredible marketing opportunity. What kind of things do you do at the St. Paul Eye Clinic to let everybody know that a new physician has joined your practice?
Well, new physicians are definitely an opportunity to share what's new and upcoming, not only in your practice, but what new specialties they are bringing to the practice, or if they're enhancing access to a certain specialty. So we try to send out letters to patients that maybe haven't been seen in a while, but need that subspecialty of care. We also will do a Facebook blast and an email blast out to any emails that addresses we have. Once the provider's in-house, we do try to bring them out to various referral sites, get them to sit down and get to know our new providers so they're comfortable with them, know who they're referring their trusted patients to.
Excellent, excellent. Yeah, it's a tremendous opportunity. I think sometimes a new provider starts in a practice, and before they do a lot of marketing, they want to make sure the person gets comfortable. But then there's the missed opportunity of the referral growth that they can experience. Jonna, Jill had just mentioned about Facebook posts, and building a Facebook following is incredibly important. I know that you've had some events that have a staggering number of increased followers to your Facebook pages. So I was wondering if you might share with us a story about how you have built a Facebook following for the different practices that you work with.
Certainly. I've been with Cats and Eye Group since, and I'll be honest, since I was a teenager. So I've had a lot of opportunity to watch sort of Facebook and the impact that it makes on our practices, and kind of embracing that technology. Years ago, we did a couple different contests. We have an aesthetics division, and we did nominate your mother for a day of beauty, and current patients could send in submissions to nominate their mothers, and everybody could vote for why that particular person should win the prize. We got a lot of followers from that one. It was very interesting. It was my first foray into something like that. So I learned you have to be careful when you ask for outside votes. We did a Love My Lasik contest. So this was actually for past patients to go in and write, 1 year later, why they love their Lasik and the impact it's had on their lives. And the biggest one that we've done, and I believe I sent you the video on this one, we did and this is, I sound like a stalker, but I actually found a local DJ. I didn't want to try to shoot too high because I know that it's, we can't all get celebrities. So we found a local DJ who had a really, really good following. I went to a couple of his events and I wanted to kind of check out his demographics, and it turned out he was a perfect patient for a refractive lens exchange. So we worked with him and we followed him through the selection process, through coming in for the evaluation, having the surgery, all of his post-ops. He was very verbose on the radio, and we did a beautiful video, and that video got us 211 impressions in the month that it aired on Facebook. So, and we continue. I think we jumped from 2,100 followers to over 3,500 followers after that video. So I have found that the organic stuff that you can do on social media has a huge impact on the practice.
That's great. Jonna, do you mind if I show that video right now? See if I can share my screen?
No, please do. We're very proud of it.
It's only 20 seconds long, but I think it serves as a great example of something that you could create. I hope everybody was able to hear that and see that. Great work, Jonna. That's a very professional product. But you also had some like a contest where people would submit their own videos as well. Is that correct?
Yeah, that's our current one going on right now, where they're submitting their own so that they can be nominated for a free Lasik. So we're watching that for our end of the year promotion. Again, our emphasis has been on this organic growth and really reaching out to the community and the marketplace to let them sort of join with us in the efforts.
Okay, I'm getting some messages that some people couldn't hear that ad, so I apologize for that. Perhaps I don't know if there's another way to share it. You could visit your Facebook page. Is that right?
Yep, and it's also on a YouTube channel. Mm-hmm.
Okay, so I would say to visit their
It's
Facebook page.
Mm-hmm.
Yeah, and she would really like it if you liked her Facebook page.
I would love it.
So what would the name of that video be for the search?
I believe it's called John Life Without Glasses. Yes.
Okay, great. Thanks for that. So now kind of an open-ended question for everybody. So for the entire panel, I'm curious if you have physician liaisons that you use to help manage the relationships with the referring providers and kind of what they do and why they're important.
I do. I think they're very important, and finding the right mix of personality with a little bit of a marketing flair and also kind of an understanding of ophthalmology and what we're working for is important. And she visits our local referral sources. She visits every time there's a new primary care or a new eye doc that sets up in town. She drops off referral pads. She drops off business cards. Sometimes she takes cookies. We try to be careful about that with all the rules around that these days. But they call and ask for her by name. People are looking for her to come into their office, and I think that means she made an impact.
We have those positions in our practices as well. It's been invaluable. The relationship she develops, she becomes the resource for those doctors. She makes sure that she takes new doctors around to every practice. We've actually structured it almost like a drug rep. We've tiered our referral sources. We make sure that we have a good plan every week. It's something that we monitor on a very regular basis.
And we have professional liaisons as well, very similar roles as Jonna and Patty's. Our professional liaison also sets up educational webinars and things like that too, in addition to visiting in person and providing materials to these offices. And she also is actually a liaison from the outside internally as well. So if she goes into an office and a doctor has, a concern about a patient or just wanted to communicate something back to the office without needing to really call, she will relay that information back. So it's truly invaluable.
Excellent. Well, that's great to hear. I think sometimes practices might think that they're too small to have a physician liaison. So I think it's an important message that no matter what your size is, that you should be interacting with the PCPs that refer you patients, and that it's a great opportunity. There are other ways to interact with those referring providers, some grand rounds type presentations. I think, Patty, you've done some of those in the past. I'm sure maybe all of you have, but Patty, can you speak about some that you've done in the past?
Yeah, we've done those and they work well. I think the important thing is to not mix your referral sources, to be careful who you're inviting to what event. The last thing you want is your referral sources to meet other people that would want them to be their referral sources. So, for instance, do one for primary care and then maybe do one for the local optometrist. And then if you have ophthalmology offices like we do who refer to us for specialty work, then do them alone. Just don't mix them all together or else you can lose some sources too as they gain relationships.
Okay, excellent, thank you. What about anybody else doing some grand rounds or educational events, either in person or online for PCPs?
We've also done some, well, not necessarily for the PCPs, but for the patients where we do lunch seminars. Okay. And we'll post a sign in our locations saying, this Thursday, maybe the topic is premium IOLs and cataract surgery. Next week might be dry eye. The following week might be aesthetics, whatever you want, just post the agenda. And then for those days, staff around in the different locations will refer patients to the lunch seminar. And we provide, snacks and, drinks. And usually it's a staff member that will run the program. And we usually offer some sort of incentive like you know, a complimentary lipoflow if they're coming to the dry eye, not a lipoflow, complimentary lipoview, you know, imaging, just to let them see their glands. So it's kind of like a screening at the same time, which is legit. You can do a screening. So those have worked really well, because sometimes your patients will bring their friends with them too.
Nice. Nice.
Yeah, we do the grand rounds as well. The other thing that we do is the surgical observation. One of the things we try to do is balance sort of smaller get-togethers to the larger CE meetings. You know, having a smaller grand rounds in the morning where it's just a handful of referral sources, maybe 1 or 2 that do surgical observation. And then we have our providers sort of pick each year 1 or 2 doctors that they're going to kind of pay extra attention to, maybe have a dinner with or a one-on-one with, and try to just continue to cultivate the more personal relationships.
Excellent. Excellent. Carrie, were you going to add something as well? I'm sorry.
No, that's
I don't wanna
okay.
put you-
We're doing very similar things as well. I agree with Jonna. The surgical observation is actually really amazing for the referring doctors to see the entire process and be able to speak to their patients about what to expect.
So they actually come to the procedure room, or is it a video?
No, they come to the procedure room. So they're following the entire process of surgery all the way through from beginning to end. And then we schedule a lunch after surgery to sit down with the docs and, you know, talk about the experience, what they saw, get their questions answered by the surgeon, and really make it, you know, kind of a really impactful event.
Excellent. So Carrie, you know, another question for you about digital media and using kind of business intelligent tools like Power BI to process the data you need to figure out where patients should be marketed to. Are you using that in your practice? And then we'll open it up to everybody else with the same question.
We are. We have a digital marketing company that we're working very closely with that utilizes a Power BI dashboard so that we can monitor and see what our results are from every campaign that we're doing in the digital space. So we can see month over month, you know, what's working, what's not working. You have to monitor it for sure. And, you know, if there's any, you know, dip or change, you know, to really look into, you know, why that might be happening. For example, we started a campaign about 6 months ago, and we just noticed that it was a refractive surgery campaign, you know, really trying to target that demographic of refractive surgery patients. And we just noticed that everyone was walking through the door was 50 plus. We're like, something isn't right. So, you know, we saw that right away. You know, we investigated it right away. And sure enough, the age demographic was not what we had wanted it to be of 18 to 45. It was at 45 plus. So, you know, being really in tune with those analytics is so important. Otherwise, again, you know, you could just be throwing your money out the window if you're not watching the data.
Mm-hmm. Any other input on data analytics? Okay.
I'll say that I think it's, you know, it's a hard, having a dashboard or something like Carrie talked about is important, because so many times, especially with branding and different things, it's so hard to track. Like, we used to be the provider for the Jacksonville Jaguars, and we haven't been for about 3 years. We gave it up, but we run specific ads during specific time zones that people assume we're still the provider for the Jacksonville Jaguars. You know, our competition doesn't like that, but hey, it's prime time for us. So you can roll on with certain marketing campaigns that can last so long, even though you've stopped paying for it for quite a while. So if you do it the right way and you brand it the right way, it can hang around for a while.
Great.
And to touch on that, Patty, we did that once too. We sponsored the Ravens. And it's interesting, when you go into those, you have to make a decision. Are you trying to brand, or are you actually looking for an ROI? And, you know, what Carrie was talking about, and kind of following up to see what your event did for the practice. In some cases, you're doing it for branding and you're not really going to find the numbers that you're out there looking for. And then there's other promotions where you really have to watch the demographics and watch the follow-up and see if it worked, in case you ever want to repeat it again, or just a lesson learned.
Absolutely. And to kind of go with what Patty was saying, everything is branding, and you just don't know exactly, you can only do so much to, drill down what made that person walk through your door, because everything ties together. They may see your TV commercial, they may, be geofenced and are getting your ads in their social media, but then they talk to their neighbor who said, hey, go to True Vision. That's where I had my surgery done. But it all worked together because you built that brand of awareness already.
Yeah, the best is when you ask a patient how you found out about us and they say your commercial and you haven't run one for 6 months, right?
Or they say the radio and we haven't been on the radio for 2 years.
Yes.
Wow, that's fascinating. So you built your brand awareness from those, and then you're top of mind when somebody needs that service. Yep. So that's fantastic. So, I guess I'm thinking about return on investment. I'm thinking about that. It's very hard to actually calculate that. And I know when we at Rate are talking to clients, we're encouraging them to pay attention to their Google Analytics, to pay attention to their Google My Business Insight numbers. I'm curious of how useful those reports that are available to you through Google are in your practices. Oh, Patty, are you?
I
There you go.
don't know how to answer that. I still have a hard time with Google Ads. My marketing person will present that to me, but we can see the change and we can see it taking place because, we have the strange thing going on right now where we've been working on our SEO and we're having people call our office who are looking for someone else's office, a competitor's office. And, my staff's like, no, that's not who you reach, but how can we help you? And of course we book the appointments when they call us, but somehow the SEO and the Google search is pulling us up instead of them. And, I'd like to see the report on how that's working because I would share it with everyone, but it's just an interesting thing. It's interesting.
Mm-hmm.
I'm similar to Patty. They show me the report and I think it looks great when our pie chart is beautiful and our bars are really high. And I love that part about it. I do rely on the digital team to kind of tell me. The one that I'm most excited about is when we get a click through or an open rate, we send something out or we've got a specific, right now, a Lasik quiz going on and you want to see the demographics of the people that are opening it. We learned early on in one of our quizzes that we were sending out to the wrong demographic, like as Carrie said, we don't want our Lasik patients to be 55 to 65. We want them to be younger, but we want our refractive lens exchange patients to be in that sweet window. So, if you learn to read the analytics, like I probably should do better, I can imagine, the way you tailor your future programs could really change the impact. And I know our digital team is really good at that. Not me, but they are.
Mm-hmm.
I like to keep things really simple. So I look at the Google stars. That's my Google My Business report. I look at stars on Google and try to see how each one of our locations is doing. And if we've had any positive reviews, try to thank those patients for making those, and any negative reviews, address those as well. And thank them for letting us know about what's going on. So I keep it simple that way by maybe not getting so deep down into the analytics of it, but look at our star ratings and really try to focus on keeping those at over, 4.6 or 4.7.
That's great. That's great. I know I can quote Carrie in saying that, reviews are currency, So I think, does anybody else want to speak to the building of online reviews? Keeping in mind, Rate is very proud to have a relationship with the ASOA in terms of actually helping the different practices build their reviews. And we're happy to do a scorecard, or actually a couple different scorecards for each of the practices that are listening. And we'll put a link on into the chat if you want to request a scorecard to be completed for your practice. We'll show you your Google Health Grades Vitals WebMD scores for all of your providers and locations, as well as how robust your Google My Business listings are. But just in terms of speaking to online reviews, I'm curious of how important they are to all the practices.
Well, I'll say that, I think for all of us on the panel, when we started out in this field, we didn't have to deal with online reviews that were sometimes snarky and bad and many times out of our control. And sometimes you wonder, is it a competitor, or where did this come from? Other times I know now, because we've gotten more sophisticated with it and we have more resources to help us with it, that we can usually trace it back to a patient. We can control a lot of that by sending them out ourselves and getting those reviews up front, so that, we know when we've made somebody unhappy before the rest of the world knows about it, right? And I just think it's important that you have a relationship with someone to help you with these, because it's hard. You can get held ransom. We've had unhappy patients, maybe nothing we did, but they'll say, if you don't give me X, Y, and Z, I'm going to put a nasty review out there on you. And I think this is hard. Everyone needs someone to help them with that reputation, and how to deal with it.
Yeah, I agree. Unfortunately, a review can really break you, and you can't, as you said, it could be nothing to do with us. It could be a billing issue with their insurance company, but they're going to hold us responsible. Having that resource to really guide you through it is critical.
Yeah, and having, your raving fans back you up. I think if you have 50 excellent reviews and you have one little troll in there, it's going to look like it's a one-off, but if you are looking at your reviews and you don't have very happy customers, if you have, 2s and 3s, that's something to really, really dig into and try to figure out what's going on. But if you have 5 stars and are getting really excellent reviews online and you have that troll out there, your fans are going to also respond to that negative review and chime in if they had a completely opposite experience. And sometimes, I hate to say this, but sometimes it's so off the wall that there is nothing even to say. We had a negative review recently that a patient walked in, didn't want to do any paperwork, and so he left. We never touched him, but yet he went online and just kind of went off about, why does he have to wear a mask in the clinic? Why did he have to do all this paperwork? And there was something that was redundant on the paperwork. So he felt he was really put out and left a 1-star review, but we never actually gave him any care. So, and that just looks like a total one-off versus actually having a legitimate complaint.
Mm-hmm.
But Carrie, it's a great point. One of the things we do at one of our practices is we actually have a incentive program around employees asking for positive reviews. When they have a great interaction with a patient, they have a 3x5 postcard that has all the different places where they can go to our review sites and list them by name and post the review. And we give away prizes if their names get listed in those reviews online.
And my docs have those in their pockets too, and they can give them out. We don't give them prizes though.
We have the same thing. Our employees give them out. We don't do prizes. Maybe we should. But really, there's so much power in the ask. All you got to do is ask someone, hey, that's a really great comment. That's so touching. Would you mind, sharing that online and giving us a review? And most people will be like, absolutely.
Yeah, most of the people that are raving fans don't necessarily go out to rave, whereas the negative people are Johnny in line, aren't they? So I do think we have to promote our raving fans and really ask them to support us and not be shy about it.
That's true. That's true. So I do like the strategy of building the online reviews. And one of the things that at Rate 8 that we tell practices is, hey, don't be afraid of negative reviews. Don't let that get in the way of you trying to build good reviews, because what we find at Rate 8 is our average scores of 4.86. So what ends up happening is we build up so many numbers that it absolutely just buries the people that are unhappy. So a 1-star review doesn't even affect the star rating because you've got so many positive reviews. Great information so far. I have a question. Again, this is for the entire panel. I'm curious about what's the best marketing initiative that you've done at your practice, kind of like a great takeaway that another practice might be able to do something similar with?
Maybe 2 different things. One is staff and social media. Our staff is very proud of where they work. They're very proud of when they see something that's amazing and spectacular, and to help them understand how to share that rightfully and not impose on certain guidelines. And then another area, again, in the branding thing, because that's my game. Our staff has hoodies, they have t-shirts, you know, put your name out there in as many different ways as you can. Your staff will love if you come in with a bunch of nice hoodies for them to wear, and they'll wear them and people can ask. I just ask them, when you're out and you're really partying and you were somewhere you're not supposed to be, could you wear it inside out or not wear it with our name on it?
I agree with Patty. You know, your staff is your number one asset, you know, and if your staff is happy, they are going to be the raving fans that you're looking for. They'll speak to your brand, they'll live and breathe it. So invest in your team as much as you can, provide education, a great culture, you know, really, you know, like Jonna's doing, you know, try to do little incentives or anything just to really help motivate them. That is your number one marketing tool, is your team. You know, people will talk about your team if they're excellent, and they'll say, you know, go to Bowden because they have the best, happiest team out there. I would say from an actual financial strategy, you know, for us, digital, I think for everyone, digital is super important nowadays, but we've also found that, you know, geofencing and geo-targeting has been very successful. So I would really recommend, if you're trying to figure out like where, you know, what to look at, you know, beyond just Facebook and Instagram, you know, try to dive into that geofencing, geo-targeting if you can, you know, your competitors, your referral sources, areas, you know, that are highly utilized in your community, churches, you know, just kind of think outside the box, where, you know, who you want to target, the demographic you want to target. And that's been very successful for us.
Excellent. Carrie, can you identify, just for the attendees, like, can you define what geofencing is?
Yeah, so geofencing, you can probably explain it better than I can, Ron, but geofencing is if okay, let's say that you're going to, you know, try to target a 25-year-old that is going to big box Lasik store. If they cross that threshold and enter into that entity, now they're attached to you. So they will be retargeted one of your ads because they cross the threshold into that area that you're putting a fence around. How did I do, Ron?
I think that's very good. It's very good. It's a complicated topic. So I guess when we start talking about things like Google ads and Google My Business Profiles and geofencing, it really gets outside of people's comfort zone. But it's an important and worthy place to put your attention. And sometimes you need a partner to help you with some of those things.
And I was just going to say that too, you know, how do you know if it's working is the question. So you really have to look at those analytics and see, okay, based on these areas that I'm geofencing, how many people walk through my door because they were served that ad. It's not a perfect science, but it really gives you an idea of what's working and what's not working. If there's zero pass through, then you know that that area isn't working. If you have even one or two people walk through your door that were served that ad, you know it's working.
I think any of us knows that this works because it's working on us. You know, whether we Google something or we mention something, it seems to be following us, that suddenly we're getting these pop-up ads. So we just need our names popping up in front of the right patients so that they come to our offices for the right reasons. It's amazing.
Any other stories of or recommendations for great marketing initiatives before we transition to questions?
I would suggest one more, you know, community involvement, I think, is big. You know, again, falls into branding, because the more you're out there, the more the community sees you involved and recognizes your, if you will, personalities. You know, we've done personalities of our physicians in social media with, you know, let's spend a day with Dr. So-and-so, and they show their pet and they show the gym in the morning, and anything to help the patients feel like they're one of us and we're people like them. And if they come to us, we're going to take great care of them. Advertising doesn't have to be super expensive. You can do it on a really small budget if you're just smart about it and you're consistent about it with your approach.
Yeah, I agree. I think, to some extent, marketing or healthcare is a community-based decision. So, showing your involvement in the community and really engaging with that sort of demographic. We always try to sponsor events in our local community, and we ask that we get a lot of digital press when we're doing it. We do one called Toast to the Ghosts, and we actually sponsor a Halloween event that is done in a cemetery, and we pick different things. We'll host the fire pit, or we'll host the storyteller, and we stream it and we show it, and we give tickets to all the staff in that location. We make sure that both our staff and our patients are aware of it. But featuring the community stuff, I agree with what Patty said. Educating on a doctor. You have a new doctor, and here's their interest. Somebody who maybe they work with Special Olympics, or they do Habitat for the Humanity, or something that really shows the community what kind of person they are. Those kind of, I think, social media interventions are very successful.
I think similar to what Carrie was saying, the things that have worked well for us are not only our employees advertising for us, but other patients, happy patients advertising for us. A lot of the times when we ask patients, how'd you hear about us? It's, well, I asked my neighbor who did their cataract surgery, or my neighbor seemed really happy with their Lasik. So I think that comes back to what Carrie and Patty were both saying about making sure you ask for them to recommend you, to refer their friends and family to you, and make it easy for them to do so, and then make it easy for the friends and family to get into the practice at the same time.
That's great. Great. Well, great. It was funny, when we started talking today, I said that, who are you marketing to? And we said, well, we're marketing to our patients, who are marketing to our PCPs. And you all brought up a really important third group to market to, which is our employees. So the internal marketing opportunities that are available to us really are something that we have to take advantage of. So great emphasis. I think that's incredibly important, the internal marketing piece. Having happy employees will definitely lead to happy patients. So a great recommendation. So we have a bunch of attendees, and some people have actually already posted some questions. So I'm going to go to those questions, and I encourage you to post a question if you have one. One of the questions was basically how many physicians are in each of the practices. So I can just run through that real quick. I think True Vision Institute has 4 physicians. St. Paul Eye Clinic has 18. And correct me if I'm wrong. Bowden Eyes and Associates has 7. And John, I'm not sure how many physicians your practice has, because I think you have a bunch of them. Is that right?
Excuse my dog. My dog has decided to join.
Okay.
My longtime practice, Katzen, is about 27 physicians, but I've got practices in the Mid-Atlantic and Illinois region that range from 1 doctor to 5 to 11 to the biggest at 27.
Excellent. Excellent. Okay. So here's a question for the group. Have any of the panelists worked or gone through a merger or an acquisition? And if so, how did you handle the rebranding during that process?
So my practice actually joined private equity back in 2014. So we kept our main brand, and we've done a number of tuck-ins over the years. One of the most important things we did was keep any really well-known brands, and then just have a tagline underneath if it's an ESP practice or a Cats and Eye Group practice. But we did a big market study for every practice we purchased to see how strong the brand was. And as long as it was a strong enough brand, we always kept it intact.
Excellent. Anybody else have an input on that?
At a previous practice I worked at, we did several mergers and acquisitions, and we focused very hard on keeping, different than what Jonna said, and keeping the brand of the primary practice as the brand that we wanted to focus on. So we talked more about how their wonderful practice was now joining this fantastic practice, and you get, the same great quality of care with more access to different subspecialists. So we talked more about how the merger and the acquisition was a benefit to the patient, to the employees, and to the providers, and tried to get that out to the patients, the employees, and the providers. For us, it was very important in the mergers and acquisitions to make sure that the employees that were coming over were happy about coming over, because that then would help them, encourage them to speak to the patients that they knew would maybe be moving over to a new practice, and be excited about where they were going and the opportunities that were there.
Excellent. It's, a lot of your practices are obviously marketing from a position of strength where you probably already had a strong reputation to start. We have a question from an attendee who's basically asking, if you have a poor reputation in your community, how can you go about changing that? If you're, maybe you're a new administrator in that practice and you're trying to bring it to the next level, how would you recommend the practice do that?
Well, I think it depends on, what the poor reputation is based on. And you tackle that specific area. Like, for instance, if you have some old employees who are negative about you, or you have a referral source that, or a competitor that's maybe behind it, first you got to figure it out. Hopefully you have great physicians who are doing great jobs and great outcomes are happening, so that you can start playing your strengths up. And you just get started, play your strengths from all the way around, the employees, the physicians, get it out there in the community and just get started. The only way to bury it is to push forward.
Mm-hmm. I guess they may be coming from the perspective of a practice that is known as a low-cost provider. So I don't know if that influences the answers at all.
You don't have to spend a lot of money to have a great reputation. Facebook's free. You can have a Facebook page for free. You don't even have to buy ads on your business Facebook page. You can promote things, promote something special about your practice that is a positive.
Mm-hmm.
Promote a testimony, get testimonials from your happy patients. Whatever it takes to push forward is what you have to do.
Yeah, low cost, high volume providers do often get bad reputations just because of the kind of practice they are. But if you could spend time marketing your outcomes, and as somebody else suggested, I think it might have been Carrie or Jill, testimonials are really, really important. If you have a really good outcome and you have someone who's willing to share their testimonial, that can really help turn the tide too. I mean, patients like to hear from patients. That's why they look at reviews.
I think that Carrie and I, ironically, are in a similar market. I wouldn't say the same. We're on different corners of a very large city. But in our community, the practice I'm at right now had pretty low ratings when it came to things like Google or on Facebook. And it wasn't necessarily because we weren't performing well. It was because we didn't ask. We didn't ask people to go online and fill out something if they were happy. So it turned into the place where our patients would go when they were unhappy. So I joined the practice just over 2 years ago, and when I saw the ratings, I was hesitant to join because I was like, ugh, what am I getting myself into? But once I got there and saw how fantastic the employees and the providers were, it was pretty easy to find a way to ask our patients to talk about us a little bit more online in a positive light. And that has really changed our practice perspective internally and externally. I think our staff are now a lot prouder to work where we work, knowing that when you go online and see where they work, it's a positive place to work, and patients enjoy and like what they get when they come to see us.
Excellent. So perhaps a shameless plug for Raider 8 and, in the ASOA relationship that we have with them. But we take the asking part out of leaving online reviews. So we'll just automatically send patients a survey where they can actually just leave an online review immediately. So again, shameless plug. So a question, how do you best estimate the marketing budget for your practice on an annual basis? Like, what kind of guidelines do you use? I skipped a question, but I feel like we already answered the question. So I hope I answered we collectively answered the review question. So I hope that was adequate, but so we're going to skip right to the budgeting question.
Well, I'll start. I'm the worst person to ask. I do a lot of gut. I do a lot of where are we at this moment? What's impacting us the most? What's going out in our community? Depends on what's going on. I know all of us are having staffing issues right now, so we have to be careful as to what we market, because we want to deliver whatever we market, with exceptional service. And I think you just have to measure the environment around you and also measure your budget and what you have available to you for that. I know there's benchmarkings out there in the industry as to a certain percentage of revenue, but those haven't always held true for me. Sometimes they're way too much and we can't stomach that. So I don't know, maybe Carrie, maybe the other ladies can speak to how they handle it.
Yeah, I agree with Patty. A lot A lot of it is gut. You know, back in the day, there used to be a formula, and Johnny, you probably remember this too, of, you know, $300 per eye for a Lasik patient. You know, so if you're thinking about what is your Lasik volume or your desired Lasik volume, that's what you should be estimating your budget. But also back in the day, we were running newspaper ads and radio commercials. We knew exactly where our patients were coming from. So you kind of have to throw that completely out the window. Like Patty said, there are resources out there to help you budget, but really you have to know your practice, your market, and what are you trying to build specifically? Are you trying to build an aesthetic, cosmetic, elective, you know, presence where there is a high rate of return, or are you just trying to build a branding campaign, which you're not going to see as much return immediately? So you got to know what you're trying to spend your money on to be able to really adequately answer that question. So it's a hard one to answer without really knowing more information.
Great. Well, great questions and great answers. Thank you all very much. So I'm going to be turning it over to Evan Steele, who's going to talk to us a little bit about the Gmb profiles. Before I do that, though, I just want to kind of reiterate that Rater 8 will happily create for no cost some scorecards for your practice, and we could schedule a 10-minute call just to go over those. We'll tell you the Google Health Grades, Vitals, and WebMD scores for all of your providers and locations, as well as show you how robust those Google My Business listings are for your providers and locations. So Mark Kopelman has just put into the chat a link if you want to sign up for having those scorecards done for you for free. Go ahead and just click on that link and take advantage of that if you'd like. And I'm going to turn it over to Evan. Great job, panel. I learned a lot myself, and I'm so excited to hear what Evan has to share with us. Oh, we can't hear you, Evan.
Thanks, Ron. By the way, for that YouTube link, if you could send it to the chat to everybody, then everyone could click on that YouTube link. I think people wanted to see that video.
Sure. Thanks, John.
Okay, good. So just a little bit about Google. These are your 8 tips for optimizing your Google My Business listings. The idea here is that you know, there are 3 types of Google searches. One is for a practice, you know, and that's your brand, right? You advertise. We're all talking about how you're advertising, you're sponsoring events. Patients need care, or they hear about you from a friend, they type your name in the browser, like St. Paul Eye Clinic. That's the first kind of Google search. And look what happens when you go to Google and search St. Paul Eye Clinic. The top is it's almost like a homepage, right? Like you have St. Paul Eye Clinic, and then you have the links here, which is kind of like your homepage where you have the providers and locations and the services you provide. And you have this wonderful looking graphic where the eye goes to, because it's colorful and has pictures. And to us, this is your homepage, right? Your website that you spent all that money on is very nice, but actually you'll find that patients view these Google listings more than your homepage and your doctor's bio pages and your location pages on your website. So these are very prominent, and it's actually the very first thing patients see. So this is a practice search, and you can see they prominently show up here. And it has a nice ratings. They started much lower with Rater 8. Now, you know, they're headed toward 4.8 or 4.9, and they already have 183 reviews. Then there's a doctor search. So I got one of your doctor's name from my Cigna online guide. I got a name from my Facebook fathers group in town. You know, some friends told me about you. I came up with your name. I have a list of names, so I can just search for the doctor. And again, the doctor comes up, their bio pages come up, their reviews, health grades, the Rater 8 ones, and where the eye goes is the profile, and you want this to look real nice, right? So this one has 5 stars, 328 Google reviews. If I'm searching through a list of names, I'm going to stop here and say, oh, this doctor looks real good, right, with all these reviews. And then the third type of search is that near me search. I did one near me where I live in New Jersey, best ophthalmologist near Bloomfield, New Jersey. This is a very, very popular search. Patients are looking for best doctors, or especially for LASIK surgeon near me, right? What is Google, what listings are Google promoting? And we could see that right here when I look for best ophthalmologist near this town or just near me. I see this Dr. John Dickoff, the Eye Care Center of New Jersey, and Bloomfield Eye Associates. So you want to be, this doctor and this listing here are the same address, same practice. This is another practice. Obviously, you want to be promoted by Google in these listings here so that you come up here and the patients don't click on view all, like go to see the list of 50 other practices that match your search. And you'll notice oftentimes when you type best, Google gives you only ratings that are filtering it out for 4 stars or higher. So if you have a listing for a doctor or practice that has a 3.8 or 9 and someone does a best search, Google's not even going to promote your listing. Google also likes listings with lots of comments because they crawl through the comments. So look how Google finds the word best in one of the comments for this doctor's 155 reviews, or best here. So, also important, one of the tips we say is, get a lot of reviews with a lot of comments. So there's more of a chance if a patient's searching Lasik, a patient has already commented about that. They commented, they said, search for, I want the best Lasik surgeon near me, so you're more likely to come up here. So those are the 3 types of searches, right? The practice search, the doctor search, and the category search, best whatever near me. So I'm going to give you 8 tips. So, how to get discovered, how to get your listings to come up when a patient's searching for eye care in your communities. What's the best practices? And we've come up with 8 tips. And I believe we're going to be sharing this slide presentation so you could have it, or you could just take some screenshots or take some notes. But I would just make sure that you follow these 8 tips to maximize how Google promotes your listings. First is claim your listing. That's an easy one. Once you claim it, I know it's a process. You have to claim it, get a postcard sent, or do phone verification, sometimes video verification. It's a bit of a hassle, but once you own it, then you can start making changes and complete the listing. So Google likes complete full listings. The more complete a listing is, and when I say complete, I mean, does it have the phone number? Does it have an appointment link? Does it have office hours, right? The more complete the listing, the more Google is likely to promote it. We hear from a lot of practices that they have this opportunity to do phone verification with Google, but they say, I have a phone tree and Google calls up our main number and we never get to verify by phone. So our recommendation for that is, this is the number that Google calls you from. So when Google does a phone verification, this is the number. Simply call your phone tree company, whoever does your phone system, and they'll write a little exception so that when a phone call comes in from this number, instead of routing it to the main phone tree, they'll route it to your cell phone or to your back line. So as soon as you click the button on that screen, Google will call, you pick it up, and you'll verify. You click a button on the phone, verify, and you're done, just like that. So try to get a reroute of this number program to your own phone. That's a good tip. It's my favorite tip, by the way. The other 7 are not as fun. There are categories and subcategories. So remember, I'll just go back here. I show the listings here. Eye care center or pediatric ophthalmologist. Just make sure your listings don't say doctor. A lot of practices that just says doctor, especially if you don't own the listing. A patient created it and just put a doctor. And think about it, if a patient's searching for a pediatric ophthalmologist, an eye care center, or they even have Lasik as a category, if they're searching for a Lasik center near me, you're never going to show up if you don't have the category correctly. Also, if you're going to put Lasik, you want to have secondary category. Make sure you have that ophthalmologist, an eye care center. So if a patient searches for ophthalmologist near me, even though Lasik will be your primary category, there'll still be a match by Google because you're allowed to have, I think it's up to 8 secondary categories. Definitely want to do that. Separate listings for your providers for each office. So think about it. I just showed you that search for the Bloomfield office. Well, what happens if a doctor practices at Bloomfield, but they also practice at the Morristown office, right? Should that doctor have a listing? So our rule of thumb is if a doctor's seeing more than 10% of his or her patients at a satellite office, create a listing for that doctor. Simply because a patient sitting in Morristown, if they say, eye doctor near me, or LASIK surgeon near, a best ophthalmologist near me. If there's no listing for that doctor in Morristown, they're never going to be promoted or come up in that Google search, and you want to be able to come up in those searches. So it's more listings, more to manage. Your reviews get diluted among different listings. If a doctor has 3 offices with 3 listings, then there's a little dilution there, but the benefits far outweigh the costs by having patients being able to search in the local area and have your listing promoted by Google. So definitely separate listings for all providers where they see 10% or more of their patients. This is just it's almost a no-brainer. There are articles about this: ratings, reviews, and recency, the 3 R's. Google's going to promote your listing if it has, compared to your competition, if it has more ratings, higher ratings, so a 4.8 stars will be promoted more than a 3.8 star. Lots of reviews, and recency is the big one. Google likes to promote fresh listings. So if the last review was 6 months ago versus another listing where the last review posted was 2 days ago, that listing with that recency, with that fresh comment, is going to be promoted by Google. So reviews, ratings, and recency are important. And that's where a software, any reputation management software, will help build those reviews and keep the recency fresh. You want to respond to reviews. Again, just think about Google. They've invested billions of dollars in their Google My Business ecosystem, and they want businesses to respond to patient reviews or customer reviews. So if it's a Starbucks, is the Starbucks responding to the patient's comments and reviews? Or are you doing that? Businesses that are more responsive to their customers, or in our case, patients, are going to get promoted more by Google. So you want to make sure you respond. It's going to help you capture more patients just by responding. NAT, this has nothing to do with me being in my 50s and a little bit tired after lunch, late in the afternoon. This actually has to do with NAT as name, address, and phone number. You could just look up NAP consistency online, and there's a million articles about it. So, there's no way to specifically tie, let's say, a Google listing to a doctor, right? So what you want to do is make sure, however you have your listing on your website, let's say it's John Smith, MD, you want to have it on your Google listing. You don't want to have Dr. John Smith on the Google listing and John Smith, MD. You don't want to have a middle initial on your website and not have it on your listing. You want the names to be identical, the addresses be perfectly identical. So if you have a location page for your Morristown office and you spelled out Boulevard, you want to make sure it's spelled out on the Google listing. If you put in Suite, SUITE 101 on your website, you want to make sure it says Suite, not abbreviated or not a pound sign 101. You want to make sure it says Suite 101 on your listing. So name, address, and the phone numbers obviously have to match perfectly as well. And by doing that, Google will actually start making connections between your listings and your website, which strengthens your SEO and strengthens the chance of your listings coming up more often in those valuable local searches, best ophthalmologist near me. So name, address, phone number. There's a bio section or a short description section of each listing. It's at the bottom. Google gives you 750 characters. This is probably, when we first start with our clients, this is probably the one part of the listing that's left out the most. Use the 750 characters to describe what the doctors do. Put some keywords in there. Say if they do LASIK, write LASIK. If they do cataracts, put that cataract surgery. Put that in there. So there's more. Those are like keywords, so it helps again with patients searching for care. And then the last thing is photos, right? Have a nice photo, a professional headshot, right? A nice office picture, or a picture of the team. If you have 10 doctors, you get them all in one nice picture, and just monitor it. And we've seen pictures of hand surgeons, and some patient puts a picture up there with a scar and it's bleeding and pussy. Like, you just want to make sure you have a very professional picture, and you want a nice picture of your office. You don't want a picture of the parking lot with a dumpster on the side, right? So just make those pictures nice, and make sure you upload professional high-grade resolution photos. Google likes higher resolution, like headshot photos, than low-resolution ones. So those are your 8 tips. If you'd like a scorecard, this is what it looks like. We go through Google Healthcare's Vitals and WebMD, and we take all your doctors and locations and score it for you. And we also look at each element of your listing. So like, see, this practice has 28% of the listings have short bios or descriptions, so 750 character descriptions. And we'll put these together for you and go just review it for you. And it's great if you have a marketing meeting, or you're meeting with the doctors, or you're thinking of buying a reputation management software. It's good to know where you are and what's going on. So we'll be happy to put that together and have a 10-minute review. And the registration link is in the chat. Other than that, we're just about out of time. We got about 1 more minute, so I think we'll just wrap up now. And I really
got 2 questions,
Evan. Do you have any? Oh, how to best estimate? Oh, yeah, go ahead.
Oh, I'm sorry. Yeah, so one question was basically a practice had focused their GMB build on the locations rather than the providers. I think you answered that, but I think we also want to make the point, and I think you already did, that if you have a provider who works in more than one location, that you want to have even more than one listing for that person. So it looked like it was a 70+ provider practice that asked the question. So you would indeed want to have individual Google My Business profiles for your providers, as well as additional ones for the locations they work in if they saw 10% or more of their patients there. And then the last question was, if you have a Gmb profile for a doctor and they leave the practice, what do you do? I'll let you answer that one, Evan.
So just with 70 providers, I hope you're at least a $70 million business a year with all the surgery and the revenues and the tests and the surgery center, $100 million. You got to put some resources, hire a company, Rate manages Gmb listings, or hire someone in-house or a marketing company just to manage them. It's not going to cost a lot, but to have 70 doctors with the right listings in the right offices, it's well worth the effort. I really think it is. We're talking, a couple $100 a doctor, and it's all managed and done. So I think it's just worth the investment, and I think it's small compared to the benefit that you would get. If a doctor leaves the practice, it depends what the relationship is. You could, if the doctor goes somewhere far away, you could give it, hand it over to that doctor. If it's part of your practice and you build the reviews, you could shut down the listing. Or you might get into a tug of war where a doctor will leave, go somewhere else, and then try to get that listing, try to wrest control over the listing. So we have, lots of stories about different personalities and what goes on. But a lot of times when a doctor leaves a practice, they just go into the Google dashboard and they close the listing. And that's an importance of owning a listing. If you own it, you could close it. If you don't own it, you can't close a listing.
Well, Evan, Patty, Jonna, Carrie, and Jill, thank you so much. I think this was a great webinar. I learned a lot, and I thank you all for participating, and I wish everybody a great day. Thank you all.
Thank you.
Bye now.